All right, everyone. Good morning. Once again, this is Mark Cuccinella, and I've got Dr. Timothy Ryan on the line with us. Good morning, Dr. Ryan.
Good morning, Mark. How are you?
Well, I'm hanging in there. Thank you very much. I'm wearing my mask, even though I'm sitting here in the studio by myself. It's a closed-in space, and who knows who's been in here. So anyway, let's get down to it, I guess. Without the county commissioners meeting, this will be your opportunity to review the numbers for the week. Let's get right to it.
We are seeing 41 plus million confirmed cases across the United States. Our case rate, new cases in this country have increased. We're now at 172,000 plus per day as a 7-day average, which is a 14% increase over last week. Hospitalizations similarly seen a slight decrease in some areas, but significant increase in others, to the point where some are actually giving rationing care because there are no more ICU beds. Fatalities. The current rate is 1,827 per day as a 7-day average, which is a significant jump. We've now lost 662,000 Americans to date to COVID. Test positivity across the country is at 9.7. All of this is being driven by the unvaccinated, to be quite clear, and the Delta variant are moving this significantly forward. 54% are fully vaccinated in this country, and 63.8% are vaccinated with one dose. Here in Colorado, seeing similar trends. Current number of daily cases is in excess of 1,545 per day. It's a 7-day average. Our 2-week cumulative incident rate is at 404 per 100,000. Hospitalizations has increased 12.5% over the last week. Currently, 43% of our ICU ventilators are in use, and 88% of hospital ICU beds are currently in use. There are over 1,000 individuals currently hospitalized in Colorado due to COVID. Our 2-week test positivity rate is at 6.1%. Again, being driven by the unvaccinated. Vaccine rate in this state, we are at 75.3% of the eligible population have received at least one dose, and 68.75% have received full dosage. Here in Clear Creek County, seen a slight decrease over last week, although the last 2 weeks have seen the highest number of cases we've ever seen in this county. So in the last week, we've had 25 cases, 65 in the last 2 weeks, for a sum total of 645. Hospitalizations have increased by 1. We're now at 30. Fatalities at 4. Our 2-week cumulative incident rate is at 667 per 100,000. Our test positivity rate is at 11.5%. Contributing factors, the unvaccinated. Testing updates. So we have now testing available 3 times a week in the county. Community testing Tuesdays and Thursdays in Idaho Springs from 8 a.m. to 2 p.m., which is an increase of hours. And then in Georgetown, will likely be on Wednesdays, and we're still working out the details of where that's going to take place in Georgetown. They have switched to appointment only, given the sheer volume of people now wanting to get tested. So do visit the Clear Creek County website and click on the COVID link and follow the testing protocol there. Vaccine update, we are ever so slightly climbing up. Fully immunized in this county is at 61.9%, and those with one dose is at 66.4%.
Dr. Ryan, will the testing in Idaho Springs begin this Thursday then? Can we expect to have that site open, but yep. Georgetown maybe not till next week?
Correct. Yep. The Idaho Springs, the additional day was added actually last week. So this week, today, and then this Thursday, there is community testing from 8 a.m. to 2 p.m. here in Idaho Springs. Yeah, at Georgetown, we're hoping by next Thursday or next Wednesday it's up and running.
Do we have a site in Georgetown?
We don't. That's one of the things we're working on right now, to find the best site available to accommodate, because now we're literally having 100-plus people come every day to the sites, and so we're trying to find one that's conducive to sort of the drive-through model.
I noticed the test positivity rate is still a little bit elevated, so if we can get those tests, the number of tests up, that should give us a more accurate reading of of how much COVID there is in the county. Is that how that works?
Yeah, we know that right now that the numbers that I just gave you, for instance, for our county, is an underestimate of what is reality out there for a whole host of reasons, both in the unvaccinated and even unvaccinated individuals who do end up getting COVID with mild symptoms, cold-like symptoms that last a couple of days. We know that those folks aren't traditionally getting tested, and so it's an undercount of what we have now. So our numbers are actually higher than what I just reported, but we really don't have any way of discerning what that level of undercount is.
Dr. Wren, would you recommend people who think they have had a potential exposure, even if they're asymptomatic, would you recommend that they get themselves tested?
I would. It's better to know than to not know. And if you do know of a direct exposure, yes, I would strongly encourage that, so that you do know, so that you are not actively out there spreading the virus if in fact you are positive. So, as they say, knowledge is power. So go and get tested. It's free. It's literally 5 minutes of your time. It couldn't be any simpler than a nasal swab or a sputum test, and you'll have the results back in 24 to 48 hours.
And it just occurred to me that I may know where the test site is, and you know where the test site is, but I'm sure there are some listeners who are not aware that it's testing down by the ball field, and you drive down that little ramp off of Minor Street there, and it's just as easy as can be. I've done it a number of times, and I would encourage anyone who thinks they've had an exposure, as per Dr. Ryan's recommendation, get on down there. I did want to go back to the numbers for just a moment. I think I read, and I could be wrong about, my memory is not that great these days, but I think I read that if you're vaccinated or unvaccinated, you are 11 times more likely to become infected with COVID and 10 times more likely to perish. Does that sound right to you?
Yeah, it sounds about right. As I've said for months now, if you are unvaccinated, it is not a matter of if you get COVID, it is a matter of when. Primarily because COVID isn't going anywhere, as we see, particularly with the level of unvaccinated folks in this country. The potential for COVID being around for several years is quite high. And so doing your body a favor and getting vaccinated and preparing it for the eventuality of getting COVID is really what getting vaccinated is all about.
Well, let's just follow up with, again, a recital of the locations where that free vaccine is available here in Clear Creek County. Yeah,
so we now are in our new building, and we are having a clinic every Wednesday in September and into October. The clinic here is from 9 a.m. to 2 p.m., I believe. It is also available in the Safeway store in Idaho Springs. The pharmacy there has the Pfizer vaccine. I do not believe appointments are necessary. You can literally just walk in and get vaccinated. It's also available at the Walmart and the Walgreens in Evergreen as well. So there's no shortage of vaccine available in the broader community, particularly places that the free shuttle bus will take you.
So if you want to reduce your chances of serious illness from COVID-19 by tenfold, go and get that simple little shot, and your arm will hurt for a day, and you'll be fine. All right, I wanted to ask you about the status of schools. Have you begun the testing? What about vaccinations for those who are eligible? Bring us up to date.
Sure. So yes, the testing has begun. We started yesterday. We've had a couple of little hiccups. One, the testing swabs that we ordered didn't arrive yet, so we had to switch to the sputum, which is basically spitting in a test tube. Tested 80-some students yesterday. That testing will continue on Thursday for the broader community. So we have begun also testing the unvaccinated staff at the elementary schools. And in those, there's really only a handful. So work there is much simpler. But at the middle school, high school, as you know, we're testing student athletes and trying to get a sense of what is walking through the door and identify it as quickly as possible, and then isolate and quarantine as necessary. All of this is being done with the primary objective of keeping kids in school as long as we possibly can, and allowing them to engage in the activities that is part of school, extracurricular, homecoming dance, sports, plays, et cetera, et cetera. It's really an integral part of what we're trying to do and identify the disease as quick as we can and take it out of the school. We have already had cases in the school and managed those quite well, and so it wasn't an outbreak. It wasn't the spread that we would see normally. So the masks have also really gone a very long way to help us achieve that. When students are fully masked and next to each other, the need for quarantine is significantly reduced. So it's, a layered approach that we're trying to achieve with the primary goal of keeping our kids in school. That's our goal. There's no other goal or alternative or ulterior motive. From our perspective, it's really about the kids and keeping them in school as long as possible.
Well, we've known since the beginning of this whole pandemic that mask wearing and social distancing in and of themselves can be protective against spread of the virus. And so, I mean, it just seems intuitive that you'd want your children to be as safe as possible when you had them in school.
Correct. I could not agree more. Having children in the school, I am not only a public health director, but I'm a parent of kids in the school. So I want them to be there. I want them to learn. I want them to experience school. And the only practical way to do that is through the measures we're doing. There's lots and lots of research now coming out across the United States comparing school districts who choose to have a layered approach, including masks and testing, and those who don't. And it's quite clear. Those who don't go to remote learning, and those that do stay in school. That's not my opinion. That is the research that is now coming out in spades across the entire country. From Atlanta and Georgia and East Coast to West Coast, the results are pretty much the same. You take a layered approach, and you can keep your kids in school.
Well, I just hope that we're able to continue this safe learning environment and there isn't an outbreak. I would also hope that at some point the school district thinks about mandating vaccines for their employees. I'm kind of a hardcore on that mandating vaccines. I'm glad to see the president has taken a leadership role in that direction. I don't think we need to say any more about that necessarily, but I did want to talk a little bit more about masks. As I said, and you did too, we know that it's protective in the schools, and we're happy that the school district is mandating masks. But, I go out in public, and Safeway's got a big sign right in front of the door, mask required. Half the people in there are unmasked. I go to the gym, and people are huffing and puffing, and 75% of them are unmasked. I just feel as though the economy and the level of participation in the community would increase greatly if there was some sort of a mandate for masks. I guess it's not politically feasible, right?
Well, I think I agree with your sentiment that the majority of folks aren't wearing masks out there. And strangely enough, I think the majority that are vaccinated. So right now, what we're trying to do is take the more of a surgical approach, if you will, to identify the highest risk areas, one being the schools, right? The schools have the largest collection of unvaccinated people in the entire county, both in elementary school because they can't get vaccinated yet, and in the middle school, high school because 66% of the parents have chosen not to vaccinate their children, even though they vaccinated them for every other communicable disease known to man. So we're trying that approach. Businesses, it's up to them to mandate masks and to enforce masks. The businesses have known that for months. So it's really up to them. I would strongly encourage anyone to wear a mask, vaccinated or not, when you are out, particularly in enclosed public places like restaurants and in grocery stores and the likes. Clearly, you can't wear your mask while you're eating in restaurants, but entering and exiting, and et cetera. And choose to eat outside as a way. The Delta variant is wreaking havoc on this country, in case you haven't been paying attention. We are now in excess of, 1,800 deaths in a day, and that number is only increasing every single week. So the virus is finding the pockets of unvaccinated. It's doing a really good job of it, and it's going to continue to do that. So masks and vaccines are the two most effective ways to prevent you becoming infected and reducing your risk of hospitalization and fatality. To your point earlier, your odds are significant of becoming COVID positive, becoming hospitalized, or dying if you're unvaccinated. It's just a risk that, at least half of America is unwilling to take.
This past week, we noted the 20th anniversary of the terrible events of 9/11 in New York City and elsewhere in the country. And it just is unfathomable to me how you can look at the response to those events, and the two incredibly brutal wars that killed hundreds of thousands, displaced millions. We spent trillions of dollars of our fortune to try and control any single event that would be close to that, but yet we're surpassing the number of fatalities on 9/11 in less than 2 days, and it's just a shrug of the shoulders. I don't understand that, and I just wanted to point out another statistic along those lines. I just read in the New York Times this morning that Northwestern University, 3 of their top researchers, put their heads together, and they did a little survey of the data available, and applied some math to it, and over 2 months, from the beginning of July till the end of August, there were 35,700 deaths nationwide. If, in fact, everyone had been vaccinated at the same level as the state of Vermont, which leads the country, that would have been 19,500 deaths instead of 35,700 deaths. It's just, I mean, you hear statistics like that all the time about how efficacious the vaccine is and where this stubbornness comes from. It's just a frustration.
Mark, you are preaching to the choir. I can't agree more. In the human psyche, when we hear statistics about the general broad population, we instantly disconnect from them and say, not me. That's not me. I'm not going to get in an accident. I'm not going to, you know what I mean? And we apply it directly to ourselves in a very disconnected way. And I think that's what you're seeing across the country. But lots of places are stepping up. Businesses, universities across the entire country, and my hat is off to them, requiring and mandating not only vaccines, but testing. And so the reality is any kid who's in school now, that is going to be the reality when they graduate and go to college. Universities and colleges across the entire country mandate them for a reason, because there's no other way to operate as a university or college or a business if you are not fully vaccinated and protected as your business, as employees or students in that university or college. That's just reality. It's also currently reality for our schools, right? The number of communicable disease vaccines required to get into school are there for a reason, and the vast majority of people follow those recommendations and guidance and get their children fully vaccinated, because they are a tremendous risk if they are not vaccinated. Similarly with COVID. And it's, people say, I'm waiting for full approval. It's been approved. There's been hundreds and hundreds of millions of Americans and billions of people across the planet who've been fully vaccinated, many of them for many, many, many months now. So the disconnect between the true risk and what you perceive your own risk to be is there, and it's how do we gap that divide, how do we bridge that divide from people thinking it isn't going to happen to them until it's too late. And, they're in the ICU asking for a vaccine. It's too late at that point. So it's, the information and facts are out there. They've been out there for a very long time. The problem and the challenge, as you are well aware, the level of misinformation is equally out there and in abundance and being consumed. There isn't a day that goes by that I don't talk to somebody who tells me something that is so far from a fact, but is the reason and rationale for why they're not doing something. I obviously do my part and try to educate and inform as best as we can, but it's a little overwhelming, the level of misinformation that's out there, and more importantly, the amount that's being consumed.
You just mentioned the vaccinations that are required for school children, the COVID vaccines that are being required for universities around the country. I wanted to ask you about a couple of different diseases and their vaccination histories. I hate to throw this on you cold, but I assume you're going to know something about these two diseases that I personally have experience with because I'm old enough. In particular, polio. The polio vaccine came out when I was a child, but I did know a kid down the street who was one of the last victims of polio in the area where I lived. And polio is just a distant memory. I think there's a lot of people who don't even know what polio is, and because of the vaccine. And the other one is measles. It used to be everybody got measles when I was a child, and nobody gets it anymore. Why? Because of vaccines. I just want you to fill us in a little bit on some of the history of those vaccines, if you don't mind.
No, not at all. And to your point, well taken. So there are a long list of communicable diseases, including polio and mumps, rubella, varicella, what we formerly know as chickenpox. When I grew up, everyone had chickenpox as a child at one point or another. Now you'd be very far-fetched to find a child with chickenpox or varicella. The role that vaccines have played historically in human history has been incredible. From what was a devastating, polio is a great example, what is an incredibly devastating disease worldwide, is brought literally to its knees, where there's a single case now in the entire world. And the debilitation from polio, if it didn't kill you, it disabled you for life. So the role that vaccines have played in eradicating these diseases is, the history is there. And it's important for us to understand and follow history, because COVID isn't any different, right? It's killed almost 700,000 Americans in literally less than 18 months. And the potential is there for that to continue if we don't take it seriously as a country and a world, and we don't address it in the ways that we have and the tools that we have. And right now, the single best tool that we have is vaccines. The same is true for polio, and the same is true for mumps and every other communicable disease. So, it's important for us to understand the history of these things, and it's important for us to understand how do we address them. How we address them, to your point, hasn't changed in 60, 70 years, because the way that we do address them is incredibly effective if it's adopted by the population at large. Like all of those, vaccines, was there hesitancy initially? Absolutely. But once people are educated and informed and see the reality behind, if we do this, take this vaccine, we can eradicate polio, we can eradicate mumps, we can eradicate varicella. And that's what we have done historically as human beings. And that isn't going to change, that reality. It's only actually improving. The vaccine that we have now was developed in a fraction of the time, primarily because a lot of the base work was already done over a 20-year period with the MMR technology. But we have the ability to manufacture tens of billions of doses of vaccine in literally a 12-month period. Historically, in human history, that never existed, that ability to do that. So we have the ability and tools. We just need to adopt them and fully appreciate and understand them as human beings.
I'm glad you brought up that whole issue of the speed with which the vaccine was developed, because I think there's a lot of people who look at that with great suspicion without understanding that this is a completely different technology. It's not brand new. As you said, it's been tried and tested in different environments within the labs before they developed the COVID vaccines over decades. And so it's new in the sense that it's been applied to a human vaccine, but it's not brand new. But it is new compared to the other vaccines that we've gotten in the past, including the flu vaccine, which I intend to get this week. I think the example that works for me is computers. There was a time when I had to upgrade my computer every 2 years because the technology was evolving so quickly. The machines became obsolete. Now I have a laptop that's 7 or 8 years old, and I can't see any reason to update it because it does everything I need it to do. Although I'm sure the newer machines are even more spectacular. But that's the way the technology works, and biotechnology can't be divorced from other innovations in that regard.
No, not at all, and I think it's only improved. I think it's a great example. So the sequencing of the SARS-CoV-2 virus was done in a matter of days, literally days. And what did that do? That changed the time gap or the time reference for development of it. So normally they would have to sequence it in each lab. But instead, with computers, they were able to sequence it and send it to every lab instantly. So that cut off many, many months of each individual company and each individual lab having to sequence the virus itself. And instead, they were literally given the genetic code because it was done once and shared globally. That's just the reality that we live in now. Things don't take 6 months to a year. They can be done in literally 6 weeks. And so, the fact that you can go up to the top of a mountaintop and call someone across planet Earth, speaks to the level of technology that we have. So people's concern about the speed with which it was developed, to your point, there's 20 years of experience in both humans and animals and labs of developing the mRNA technology. It isn't new. The application of it is new. And the speed with which they did everything else is really how we got vaccines so quickly.
All right, Dr. Ryan, let's hope that we can convince every week we have these discussions, and my fervent desire is that every week we convince a handful of people who might still be vaccine hesitant or for whatever reason they haven't been vaccinated yet. I hope we can convince just a few. And if people have more questions, I wanted to remind everyone that they can call 303-670-7528, and your questions can be answered. I don't think that there's a live person. You can leave your name and number. Correct me if I'm wrong here, Doc, but isn't that how that works? You leave your name and number, and someone calls you back with all the knowledge and information you might need regarding the vaccination.
Absolutely. Yep. Leave your name and number. We'll get back to you. We also have lots of FAQs, frequently asked questions and answers, on our website, and links to others on the CDC, the NIH, CDPHE website, and link to all of those as well. So we haven't really gotten any new or unique questions recently. There's lots of redundancy, so we've added those there so that if you do have those burning questions you want answered, the odds are you're going to find the answer there on our website or link to it.
I also wanted to mention when we were discussing the places you can go and get a vaccination, if you have concerns that you'd like to speak to your personal physician, I know for a fact that my physician has vaccines available as well, and if I needed one, I could go ask him the questions that I have and receive the vaccination directly at that office. Do you find that to be generally true?
Yeah, most providers are able now to provide the vaccine. So on the CDPHE website and linked on our website is actually that. You can find a provider. There's over 1,500 providers in the state of Colorado alone where you can go and get vaccinated. And to your point, it's an opportunity for you to have a discussion with your physician. If you have specific underlying health conditions or otherwise concerns, the physicians can do the same exact thing that public health does. But if you want to do it in the comfort of the office, just know that they very well may charge you for a service provided. In public health, it is free, as it is at the pharmacies.
That's right. If you have a copay, you're probably going to be obligated for that copay. But I think there's many people that would very gladly pay that extra fee for the opportunity to have a face-to-face discussion with their physician. It sounds like it could be worth it. I just don't know how it could be made any easier. And please, folks, if you have questions, get in touch with your provider. Call that county number, or as a minimum, you can stay completely anonymous. ClearCreekCounty.us and go to the COVID page on that site, and all the information Dr. Ryan has spoken of is available to you anonymously. So again, please get on the bandwagon. Most of your neighbors have made that decision. All of them that I know of have successfully been vaccinated without a deep complication of any kind. In the face of many people being hospitalized or severely ill, or even we've had some deaths here in the county. You don't have to be part of that. You don't have to be spreading it to others. Just let's get on that bandwagon.
Could not agree more.
All right, Dr. Ryan, thank you so much for your time, and maybe next week after the county meeting we can catch up once more.
Sounds good, Mark. Be
Thanks.
well.
Bye now.
Bye.
All right, everyone. Dr. Timothy Ryan, I so appreciate him coming on and sharing all that information with us every week. And like I said, if you haven't had that vaccination, it's free. And all the information you could ever need is on those websites and available. You can speak to a nurse on the phone. Go to your primary care physician if you have concerns. And Dr. Ryan brought up the great point. If you have comorbidities that are a concern to you, your physician can help to talk you through those and see if maybe you're one of those very rare people who isn't eligible for the vaccine. But most people, no matter what your chronic underlying conditions are, you're much better off to be vaccinated. Okay, that's enough of me talking. Thank you for listening today, and we'll see you again next week. Here's some pre-recorded music for your listening enjoyment.